So welcome everyone to the Social Service Workforce webinar series brought to you by the Global Social Service Workforce Alliance through funding by the United States President's Emergency Plan for AIDS Relief, or PEPFAR, and the United States Agency for International Development, to the For Children Project implemented by a consortium of organizations and led by Catholic Relief Services. I'm Amy Bess and I'm the director of the Alliance. So today's session is the 22nd webinar in our series and is focused on building the evidence base for social service workforce strengthening. On today's webinar, we'll be taking a look at just providing a bit of background about the Alliance interest groups and how this project came to life. We'll be talking a little bit about the elements of this evidence review project. We'll be providing an overview of some of the evidence that was identified and compiled, and then providing some background on the research questions that were prioritized in June. And we'll also be providing an opportunity to have a good amount of time at the end for feedback and on the questions and some discussion around those questions as well. So first we wanted to provide this slide on the framework for strengthening the social service workforce. The Alliance has adopted this framework for social service workforce strengthening that was used at a conference held in Cape Town in 2010. This was the conference where participants helped to formulate the idea for the Alliance. The framework recognizes that strengthening or developing the workforce requires a multifaceted approach and a real knowledge of the specific context, such as social service systems, the culture, legislation, the economy, and so on. The framework highlights that when the workforce is well planned, well trained, and well supported, they'll be better able to address the needs and enhance the resources of vulnerable children and families. In terms of planning the workforce, this aspect looks at having strategic plans in place that are based on data about the workforce so that you know how many vacancies there are, how many workers are needed for given caseloads, and that ideally there's legislation in place that supports or helps to define the workforce needed. And then developing the workforce is about having adequate education and training programs in place with qualified trainers based on the need and demand for the social service workforce. Supporting the workforce is a critical but often overlooked area and includes elements such as supervision, staff care, work environments, and recognition of the workforce. So this framework is what provided the structure for the evidence review process that we'll be presenting today. So we also wanted just to provide a little bit of background on the Alliance interest groups. Their purpose is to convene experts into task-focused and results-oriented groups to address an area of specific interest to Alliance members. The groups also gather and consolidate information on their specified topic, and they develop products like this evidence review process that are intended to advance knowledge, promote discussion, and identify solutions. So the groups that we have so far are the interest group on paraprofessionals in the social service workforce, and then this building evidence group for social service workforce strengthening that we'll be talking more about today. We need to note that for this building evidence interest group, it has 3 co-chairs who've led this work over the past few years, and this project really would be nowhere without all of their hard work, along with the many members of the interest group. And the co-chairs are Mark Canavera from the CPC Learning Network, Mari Hickman from Palladium, and Maury Mendenhall at USAID. And also just to note that we will soon be starting a case management interest group, likely early in the new year. So we also wanted just to talk a little bit about why this push for building the evidence, how the interest group came about, and how the interest group initially identified this need to do the evidence review process. We all know that hopefully that the workforce is the core of the social service system. You know, without these critical people in place to support children and families, the work really won't be carried out. But we also know that research about the workforce is scattered and fairly unorganized, especially when it comes to questions around planning the workforce. Do we have the right people in the right places? Around training and educating the workforce to really meet service demands. And then also research around the issues of supervision and incentives. It can be out there, but it hasn't been well organized. We know that there are a number of new research studies that are emerging that show, for example, that a combination of social protection interventions such as cash, psychosocial support, and education can have strong effects on HIV risk behavior reduction. Other research shows that layering psychological and behavioral interventions is associated with risk reduction behaviors, but while we believe that a social service workforce is critical to carry out these interventions, these studies don't always address aspects of that role that we need to learn more about. So it is important to organize the current state of information specific to the workforce and to better understand what we know and also what we don't know but really need to know so that we can identify the most important research gaps to move forward. So let me go ahead now and introduce today's speaker. Ginny Roby is a former child protection worker and attorney for abused and neglected children. Since 1998, she has served as professor at Brigham Young University in the U.S., where she teaches courses on social work theory, practice, and policy, particularly at the global level. She has consulted with countries in Asia and the Pacific, Africa, and Latin America on building child protection systems, including child protection laws and policies, workforce capacity building, case management, and adoption reform. Ginny has published widely on these and other child protection and child welfare topics, and we're especially grateful for her work as a consultant who really pulled together this Building Evidence project. When Ginny has finished her presentation, we'll facilitate a discussion on ways that the research questions identified can be refined and operationalized, so be thinking through any feedback you have as you listen to the presentation. So thank you, and I'll now hand the microphone over to Ginny. Ginny.
Thank you, Amy. Thank you so much, and good morning and good afternoon and good evening to everyone. I'm so happy to be with you all, and I see most of these names are familiar to me, and I feel so lucky to be joined with friends and colleagues from around the world to discuss this important topic. Thank you so much for joining us. So I am very honored to have been asked to talk about the evidence base on the workforce, and I really learned a great deal by doing the evidence review. Well, in the beginning, as it turned out that when we focused on evidence based on social work and social service and social welfare related workforce, we found that the evidence was extremely marginal and very small, and the quality was really poor. And so it became necessary really to look at allied fields. And so that's what we did. We found that much of the great, or rather more robust evidence was coming out of the health, education, business, and organizational behavior fields. They have had a longer history of researching and applying more robust research. And so it ended up that we accumulated over 200 peer-reviewed journal articles, grade literature, and reports based on organizational experiences and lessons learned. So that was very interesting for me, and what we saw was that there are many, many gaps in every field, not just in social welfare field, but that we can learn a lot from their experiences, and possibly we could apply the research methodologies that they used. So there are many promising areas of research, I believe. So with the matrix organized and having done the review on the three major points of the supporting the social welfare workforce, developing the workforce, and planning for it, we held the evidence review meeting, and many of you were there in June in DC to review that evidence and to prioritize from among a huge list of research questions that people had kind of compiled. And then we added those prioritized research questions into the final version of the evidence analysis. So it's been quite an interesting process, a very rich learning experience, and I think one that has opened our eyes to how much work there is ahead, and especially in light of what's happening in allied fields. And at the same time, I think we're at the beginning of a very interesting, very exciting part of the global social workforce development. And I'm excited to be a pioneer in that. So these resources were, as I mentioned, developed. There's the evidence matrix for the social service workforce that you see on your right side of the PowerPoint slide. Now this is a living document, and I'm not sure, Amy, how people can access it or whether you are inviting direct input, but this is something meant to be added to all the time so that as we come across studies and different project reports, we can keep adding to it. The other, of course, is the written up evidence review, which I'm really hoping that will need revision soon because the evidence, more and more evidence will continue to be found. Thank you for that. So let's take a quick look at some of the research findings that we were able to unearth. So the next few slides will really talk about the big pieces that we want to share with you, and also maybe talk about some priority questions that we can be posing. So in terms of planning the workforce, there are concepts like mapping. This can be at the national level. Sometimes we see that it's done at a more provincial or district level. There is some effort to try to identify the underserved areas and the needs that there are in those areas and how to strategize to make sure that those underserved areas do receive the necessary workforce. And of course, there's a lot of talk about information and communication technologies. It's very much in the nascent stages. It seems like there are multiple efforts right now in different regions, and even in the same country we see different initiatives. And of course, it might be important to talk about standardizing so that there can be data sharing, research that can, coalesce the data that is collected, and so on. So I think that one of the big things that we need to talk about is the second bullet item on the right-hand side, and that is how can we utilize a mapping system to be able to understand the demand and the need for social welfare workforce and to contribute to the planning of the national policy. So in terms of numbers, job descriptions, their career trajectory, and so it's an overall way of mapping, planning, and hopefully translating to developing and strategizing. See, and then another question that a lot of people were concerned about is the image of social welfare workforce. How can we enhance that image so that it becomes a more attractive career, so that we can recruit qualified people and retain them? So those were a couple of questions that we identified. Should we go on to the next one? Okay. In terms of planning the workforce, more about that, the decentralization process that's going on in many, many countries has had its pros and cons. It is impacting funding, of course, and that's and structurally, in terms of governance, different the local governments are having to come up with sometimes their own recruitment strategies, their own funding, and of course they have more control over the deployment. And we have seen some good examples and some examples where countries, local governments have sort of dropped the ball or aren't sure how to go about that, so that becomes an issue. We also looked at governance in terms of centralized governance, where in China, for example, they have standardized social work curricula from top down, and they want to use only degreed professionals, whereas in South Africa, there is a movement to build the workforce at the grassroots level all the way up to the professional levels, and the national policy and governance reaching down to support the grassroots development. So an interesting contrast and comparison there. So I think it's very probably context specific, and but we don't have a very good framework for understanding how these needs can be met. There is a great movement, as we all know, to develop paraprofessional cadres, for example. There have been limited studies on the effectiveness of the community-based parasocial worker cadres, but we don't know exactly how to maximize the potential there. And so on, and what kind of support might be needed. So these are some of the things that we need to learn. Okay. So the policy framework, it seems that a lot of policy frameworks are talking about the rights of children, and of course rights of parents to raise their children, some of the need to support their efforts, and so on. But unfortunately, it often doesn't reach clear down to the workforce that is needed. Now, there are examples, as you know, and I see Philip has joined us. The Myanmar social protection policy, in fact, addresses workforce issues. We know that South Africa and China have also addressed workforce issues, and they have become mandates under national policies to develop the workforce, and sometimes even give, in their administrative regulations, there are even numbers in terms of ratio and of workforce workers. So we think we'd like to know more about the effects of those kinds of policies on implementation and actually budgetary allowances, and what are the cost benefit effectiveness models to support strengthening the social service workforce. We really don't have a very good framework for understanding, because outcome research is, again, very nascent in social welfare. So we have a lot of work to do, because we know that when it comes to policy, and if the policy is going to reach down to dedicated funding and workforce and so on, we really need to have better information about the cost-benefit ratio. So, okay, let's go on. Now we're going into the second major area of strengthening the workforce, which is really developing or training the workforce. Okay, so one of the first issues is to talk about aligning the national social welfare policy and training the workforce. Okay, so this is beginning to emerge, especially in countries where there are some very clear national policies, but we don't see a lot of that. And also there is some evidence that the workforce is developing and aligning with the national policy, but in other cases the policy seems to be sitting on a shelf somewhere, and the workforce is developing on its own through the efforts of many different civil society actors, and there is a disconnect between the legal mandates and what's really happening on the floor. So, and also in terms of wanting to fill the gaps in evidence, we need to talk about multidisciplinary workforce development. So, because we all know social welfare doesn't occur in isolation. Social welfare by definition requires integrated, multidisciplinary workforce, and because of that we need to actually do some more training that is involving multidisciplinary actors, different sectors. So that's one thing. Okay, next one. So developing the workforce, there are actually many different components that have been addressed, not so much researched in every one of these areas, but we do have some pretty solid research that cultural competency makes a huge positive impact. I think that comes as no surprise. We also found that competency-based training curricula are the norm at all levels, despite some disagreement. It seems like almost everybody is going to competency-based training, even at the very basic community level, like Nathan, you did in Tanzania. Field education, of course, is the signature pedagogy, but many problems related to that, especially in the low to middle income context, because of the paucity of appropriate agencies that can spare the supervisors to provide the training, and sometimes because of lack of supervisory skills and resources. So those are big issues, but yet field education is so central to social welfare training that we must think about strengthening that. Role clarification between the formal sector and the informal sector is another big deal. I think there's been some promising projects coming out of, for example, like the Sunrise program, I think has done a good job of separating those two, but linking the two for a more fluid range of roles. So that's encouraging. Task shifting is happening big time. Task shifting, of course, it came out initially out of the medical field, and we see this happening in the social service field as well, both horizontal and vertical. And so we need to study that more. We need to see what the impact of that is. People taking on tasks that normally perhaps higher qualified people would have taken, or kind of jumping over to a different area than what one was trained for. we need to really understand the impact of that. So there you can see the discussion questions on the right-hand side, but obviously each one of these areas and their different linkages present many, many research opportunities for us to understand better. But I would just really like to emphasize the one about field education and how can we strengthen field education through the development of better resources and supervisory capacities. Let's move on. So now let's talk about supporting the workforce, which of course, like Amy said, without supporting the workforce, we have huge issues of burnout, high turnover, less quality work, so on and so on. And we know from USA, UK, Australia, and all of these countries that have been providing social welfare services for quite a long time, that supporting the workforce really is as important as recruiting and developing them. So we need to think about that. Okay, so unfortunately, some of the evidence is not very strong, but where the evidence is very strong is about the supervisory relationship. And the effects, the positive effects of regular supportive supervision. Okay, so not sort of, okay, let's see what you did wrong type of supervision, but a very supportive supervision where the relationship itself is very positive, and where the supervisor is looked upon as a trusted mentor and somebody who might be able to bring resources to the difficult tasks that the worker is challenged by. And there's been some talk about peer support supervision models with some mixed results. Peer support is sometimes the only thing that is available in some settings. We found, for example, in Myanmar, that peer support was essential because the lack of trained supervisors, and also because in some remote areas, that's all you've got. And so we need to understand that better. We need to figure out how we can use the model in a way that would produce positive results. Retention is also a big challenge, and of course, there are some major forces that really erode the morale and the incentives, and so, you know, such as burnout. Vicarious trauma is a big deal. Serving traumatized people and feeling the secondary impact of that, and also compassion fatigue, just day in and day out caring about people and just being completely drained. And so how do you do self-care? So those are big things that we need to talk about. And of course, research shows that good salaries can go a long way towards minimizing some of the, at least that's an incentive that can sort of not minimize, but at least reduce some of the impact of job-related stress. Of course, effective leadership and management systems that really support the workforce rather than outcome in terms of client numbers served and so on. You know, it's a delicate balancing thing, and so never to forget that the workforce needs to be cared for as well. So I think another big thing is the bottom bullet on your right-hand side. Country after country, we hear from dedicated community-level paraprofessional workers who say, we love the families, we love the children, we love what we do, but we really need more incentives. We are really feeling like we're not valued. We're kind of looking for maybe other career paths. we're just feeling like nobody hears us and takes us for granted. And I think we need to really think about how do we possibly create some sort of incentives, support mechanisms, possibly remuneration, and motivation. So let's go on. So I
Okay.
guess that,
Yes.
yeah.
Yeah, thank you so much, Ginny. That was a great presentation on all of the work that's happened so far. And as Jenny mentioned, this is a kind of a living process, an ongoing process. A lot of people from across the world have contributed to identifying these research questions that were in that right-hand column of those charts that Ginny reviewed. But it is an ongoing conversation. And so we wanted to use this webinar as an opportunity to hear from a number of people like yourselves who can continue to contribute to this process by really thinking through how these questions can be refined and how can we actually begin to operationalize some of these questions, whether it's integrating some of these research questions into ongoing projects or initiating new research studies. So I would ask everyone to keep their microphones muted and to kick off this discussion. I'll just be calling on a few specific people to provide some feedback. You can also all use the chat window to type in any questions or feedback that you'd like. So thank you again, Ginny. And I wonder, Becky, would you be willing to provide some feedback on these questions or on the idea of operationalizing these research questions? I think especially keeping in mind that we're often carrying out this work in terms of looking at the social service workforce, often with very low resources and without a lot of funding to carry out enormous research projects. So Becky, we were interested in hearing your thoughts and feedback on this.
Those are a lot of questions to think about. I think one of the key issues is what systems are in place to monitor and to collect data about what's happening. Often that's one of the, it's hard to collect evidence unless you have systems in place to collect the data. And I know in some countries they're trying to set up systems to, whether it be about the workforce in terms of who's in the workforce, what education they have, the experience, as well as systems that track the interventions, whether it be case management, doing the assessment, doing the case plan, doing the follow-up.
Right.
So I think getting questions about what monitoring systems are in place, what indicators, what are the indicators that we're using.
Great. Yes, I agree. And I think that, yeah, that's definitely an important part of what the group has looked at in terms of what kind of mapping exercises exist, mapping tools, how is ICT integrated into that process. So great, thank you, Becky.
Right, and I think that's, when you look at healthcare, they, based on what Jenny did, they're far ahead of us in the social welfare area.
Right,
because they do have more of the ICT, the systems in place to actually monitor what people are doing.
Great. Ginny, any reactions to that before we move on to another? Yep.
Yeah, great question, Becky. And yeah, it's very, very scattered. Even as we speak, there are so many different initiatives, even among the social welfare sector, to track information at the case level and at various different administrative levels. And so that's, I think, something we need to do. Just to put some things into perspective, the healthcare profession started this dialogue about in the 1960s. So we're something like almost 60 years behind, or what does that make? Yeah, 55 years behind, something like that. But yet, it's encouraging that we have come together as a global community to talk about these things. So I do think that there are some indicators that have been developed, for example, by USAID on the child protection system, including the workforce. I don't know to what degree that can be actually implemented, but these are really, I think, important discussions to have. So even collecting data at the case management level, for example, it's absolutely all over the place, and while I think some contextualization is very important, I think that it's very difficult for us to have a global dialogue, global discussion, when we really have every kind of fruit, not just apples and oranges. And so it's a very important question you're asking, Becky.
Great, thank you. We're also very fortunate to have with us today Sam, who's from the African Institute for Children's Studies, and they're known for their research on child welfare topics. And Sam, I'm wondering if you have feedback for us today on this presentation and ideas for how we can move ahead with operationalizing some of these questions from your own research experience.
Yes, thanks, Amy. Thanks, Jeannie, for the good presentation. I do agree with Becky that what the beginning of this is the systems, because the first question is who has authority in the sense of being able to take, let me call it census, how many are we, what qualifications do you have? And like Jeannie did mention, there have been attempts where the CSOs have driven this and not governments. But then we know the challenges of even coordinating the civil societies on their own. So beginning point is, of course, building this within a system. In Kenya, for example, we've tried to input to that in the new law on children, the Children's Act, that we want to give more powers to regulate the social workforce to the National Council for Children's Services, which has not been having that. So every Tom, Dick, and Harry walks into the sector and says, I want to do something about this. Also important as part of operationalizing is, I think we're talking about this at a very good time. As
Sorry, Sam, we're losing your connection a little bit. Okay, we've got you back. Go ahead.
You know, board. What we're trying to do here is, can we have, because then these indicators on social services workforce is part of what should be tracked on an annual basis, and we can borrow from what exists, with what the USA and others have done, and perhaps be very clear on the outcomes we are tracking. In my opinion, we should be able to answer the question of how responsive is the workforce, how responsive also is the systems that, as we look at the policy and legislative framework, does it support the development of the workforce, and regularly work towards improving that. How effective is the workforce? Then, of course, there's a question of quality assurance, which builds into sustainability of the outcomes. It should also build into the ability to motivate and retain the workforce. So some of what we've used to try and track this is, I mean, if you use a simple tool as a Google form, for example, and regularly pass a form that, people who are working in the sector are able to give their feedback, what are the training needs that exist, and I think there are opportunities in using IT platform. Mobile telephony is increasingly being accessible in many countries, and I think that would be a very good thing. And as I think Jenny mentioned, CPMS, as being built in many countries, definitely provides one of those platforms. I will say maybe we can borrow from the health sector also, the client exit interviews. I think that has not been there in most of the countries, at least where I'm working. I don't see anyone going back to ask a child who's been served, can you give a feedback on how you were served? But I think that will give us a very good information on what to do. I want to go back to the question of field questions, field education rather. I think that's really a good opportunity. We are attempting to do that by having a collaboration between the universities and practitioners. So in our case, we are a civil society organization, but we have memorandum of understandings with Daystar University, with Makerere University, and trying to have a mentor both from the academia and those from practitioners, working with those who are graduating with their master's degrees and getting into the sector. But then the question, of course, will be who tracks, quality improvement in terms of what these people have learned over time, because you're thinking about a 9-month to 12-month. That includes an action research. So you're attached to a mentor, you have a component of research and training, and over time we're able to assess how are you doing. But ultimately, perhaps when you have the national authority that looks at social service workforce and tracks the progress, that will be a good point to help us see whether all these initiatives will be adding value to the process.
Thank you so much, Sam, for that great input. Ginny, do you have any reactions to his comments?
Well, thank you. Thank you, Sam. Well, my problem is I have so many thoughts going through my head right now, but about so many different points of what Sam has said. But the one thing I want to key in is really the role of civil society actors and the partnership between government and CSOs. I find that a lot of work in terms of developing the workforce is being done on the job training-wise, and also in terms of field internships through CSOs. And so I think that they play a very large role, and so that's one thing. In terms of harnessing the outcome of the services provided to children, I really welcome the idea of exit interviews. I think that that's one way to involve children's participation and to have their input in terms of learning about the effectiveness of social services. So I really applaud that idea. Thank you.
Great, thank you, Ginny. What we can do now is, if anyone does have any other questions or feedback, feel free to type that into the chat window. You could also unmute your microphone if you'd like to make a comment, but I will be calling on people to then comment. So I will be able to see if you're interested in commenting by whether or not you unmute your microphone, and I could always call on you. But also feel free to post any questions in the chat window. So maybe give everyone just a minute to think about that and any additional thoughts that you have, particularly those of you who have experience carrying out research in low resource environments, in how to carry out some of this work. Thank you, Jane, for your comment that Save the Children in Myanmar does exit interviews with families and children. It would be interesting to hear more about how that information is being captured and used in order to influence program design and kind of feedback into the implementation process or into training of the workers and how to improve services.
Okay, if I unmute my microphone, can you hear me?
Sure, go ahead, Jane.
Yes, I mean, I think the feedback from those interviews has actually resulted in, gaps in training being recognized and then those gaps being filled. The team have also been working on competencies for their social service workforce in Myanmar, and so the feedback, the information they're getting from the feedback interviews has also influenced the development of their competencies. Thirdly, they've just set up a technical advisory committee to actually support the whole case management work that is funded by UNICEF, and it's strengthening and working with the government to develop case management in Myanmar. And so they're working actually to, so they're working with that advisory committee to actually see which elements of the program actually need to be strengthened, and then working to strengthen it. I just, in line with that, I was interested, and I think it's very late here in Bangkok, but I'm still on the call because I think it's been a very interesting discussion, and the presentation was great and touched on so many areas that we're struggling with, I think, and really trying to address within Save the Children in our systems, child protection systems work. But I was particularly interested in the question of kind of field education and competency-based training, and in India we've really tried to support the training of social workers or protection officers within the integrated child protection system. We've tried to support them with competency-based training. So I'm just wondering, why there's a kind of considered to be a difference between those two elements, and whether in fact they can't be combined. We have just finished training mentors or assessors, and we will actually be working to provide supportive supervision that has a degree of assessment in it, to actually consider how far workers and protection staff are actually meeting the competencies or the occupational standards that have been laid down, and then supporting them to meet those standards, and over time we're aiming for qualifications. So I think the other element that I don't remember Ginny perhaps talking about so much was around qualifications, and our aiming for that, because I think that's not only motivational to actually include qualifications, but it's also ensures quality control, especially if we do take that competency-based approach and actually provide a form of supportive supervision or assessment on the job.
Mm-hmm. All right.
I just wanted to add one more thing, if you'll allow me, and that was to do with China and South Africa. I think it's very interesting what South Africa is doing. I think they're, very much kind of the community-based parasocial worker model is really producing kind of results. What I see in China is that people perhaps are coming out with degrees, but they're they lack an enormous amount of confidence in actually being able to work with families and children, because there's no real practice within those degrees, and there's a lot of it is very theoretical and academic, and probably a lot of sociology in there rather than necessarily social work. So I just wanted to kind of add that I think when we're doing the comparison, it's an interesting one, but at the end of the day, the degrees, I'm not sure that they really are enabling people to come out and work closely and work effectively with children and families. Okay, thank you.
Great, thank you, Jane, for that great feedback. Ginny, we'd love to hear any of your feedback or input on that.
I would like to invite Zenny to talk about that, because about the grassroots-based approach perhaps in top-down countries, and we don't mean to be isolating China, but such as China, that really uses a top-down approach where it's theory-heavy and perhaps not so much practical training at the community level. Because Zenny is very interested, if you will speak on that a little bit, Zenny, about your interest in introducing the model to China. And I'm thinking that probably some of your concerns are along the same lines with Jane. Zenny, are you there?
Yes, I am. Thank you. Thank you for giving me the opportunity to share. I think that what we did in South Africa, which is, I think, a commitment of South African government, is to localize the development of our workforce. So I think because of our history of apartheid, the idea was to go into the most disadvantaged communities, recruit unemployed local people, and then train them incrementally into skills that would allow them to provide child protection services and support communities. Now, the program I work with is focused on building child and youth care workers, child-focused workers who work flexibly, but always in the best interest of children in these communities. And the model that has been adopted by government has been Zibindi. And when you were talking, Jeannie, I realize as well that workforce development is so complex. There's so many different aspects that has to be put in place. It's good to have a professional association. You've got to have the appropriate training. You have to have the training basic enough for people to grasp, but always being refined and enhanced to meet their growing capacity, as well as to help them understand how to respond more effectively. I thought what was really interesting in the Zibindi model, because now it's 15 years old, and we've developed child and youth care workers who have actually completed their degrees over these 15 years. They've started off as unemployed local people who have trained at a very basic level, and then they did an auxiliary para-professional training, and then some of them found that this is where they found their professional identity and decided to study further. But what they have now is their degrees and are at project supervisory level and still have the embedded localized knowledge. And I suppose in a way it's worked well in terms of service delivery in South Africa, and you might know that we're replicating this approach with UNHCR with refugees as well in Zambia and now in Lebanon. So the idea of how would it be relevant to other countries like China, if we were to talk about how could child and youth care workers be developed in that kind of approach, is something that we have, I think, some experience to share in, and it has shown some good success. And I think that since you're talking about evidence-based, we were counting that there are approximately, I think, 25 pieces of research that have been undertaken on the model by different role players, including USAID and PEPFAR and UNICEF as well.
Great.
Yes.
Thank you, Zenny. Thank you. It's great to see the amount of research that's come out of that project. It's just fantastic. We do have a question from Adis that I want to get to, and to see if, Ginny, you have a reaction to this, but he is wondering about the evidence that is available that links the system-level contributions by way of standardizing training and development through training institutions, development of competencies and curriculum. So kind of what evidence exists showing that collaboration between CSOs providing training and system-level contributions. You'd mentioned Sunrise, and that may be one good example.
Yes, that's what comes to mind for one thing. Of course, that was more localized rather than nationalized. But I think there are some other efforts around the world to work with the government to do some standardized training. I know there's been a lot of talk in Ethiopia also about nationalized standardized training, which some of the training would be done by CSOs, and yet it would be under the umbrella of a framework that is provided by the government and sort of, you know, embedded into their government mandate and structures. And so I think there are programs like that. Sometimes there are sector-specific training that is more collaborated between government and CSOs. For example, in some of the countries like the UK and the United States, there's a lot of child welfare training that is done with universities, including private universities, and with government funding under standardized curricula and so on. I believe there are models like that in Australia as well. And so I think that we are beginning to see some of these different models where both government and CSOs are playing parts, but under a common umbrella. Time is running out, so I'm trying to keep things really short.
Yes, thank you. We do have time for any quick comments. I hear Sam has made a comment here that one of the greatest gaps is in the middle level managers and professionals who will handle referrals. And I think that that has been recognized in many countries. It's very true. He also notes that parasocial workers at the community level often serve as the first entry point, and then the middle level professional will be the one to respond ultimately, yet who decides on what competence training is required? Is it the social service workforce or professional bodies? And I think that's very true, that the Global Social Service Workforce Alliance has brought people together across many countries and different stakeholder groups to think through competencies for paraprofessionals. And various professions have competency standards for those professions in many countries, for example, social workers or professional child and youth care workers. But sometimes those higher level paraprofessionals or who may be managers or supervisors are often lacking those level competencies. So that's a great point, Sam. At this point, I think we will close the session. I do want to thank Ginny for your excellent participation or excellent presentation, but not only the presentation today, but all of your work throughout the process of this project. Like we've mentioned a few times, this is an ongoing process, and we really do welcome your feedback and input. I've put my email address in the chat window so that you can stay in touch and continue to provide any feedback to this project. We really are interested in finding ways to continue with refining these research questions and really looking at ways to begin implementing them. We also just wanted to give everyone an opportunity, if there are other events or that you'd like to announce, please do so by typing the information into the chat window. If you're not yet a member of the Alliance and are interested in joining the Alliance to get future notices about webinars or new resources or new evidence that's being produced, please do go to the website that's on your screen to register. And also, just as a reminder, we will be circulating a summary and recording of this webinar to our member mailing list. And it will also be posted on our website. We have all of our past 21 webinars on our website with short summaries and then links to the recordings, which we post on our YouTube channel as well. So please join me in thanking Ginny. Thank you to all of you for joining us today. And we wish you a great rest of your day or evening or night, depending on where you are. So thank you again, Ginny.
Thank you. Thank you so much. And thanks to everyone for your participation. And let's remember that we're all sort of pioneers in this. Let's imagine ourselves 50 years from now. Maybe we won't be here, some of us, but how exciting things will be if we keep this effort going. So yeah, we are in the cusp of a very important development. Thank you.
Thank you, Ginny, for ending on a very hopeful note that we need today. Thanks a lot. Thanks, everyone.
Bye.
Bye.
Bye-bye.